Minister, the INMO have sanctioned a campaign of industrial action over the unsafe staffing levels that we are facing in our hospitals. Something, by the way, they've been saying for several years, and it is getting worse and worse and worse. Patient safety is being put at risk. Staff morale is absolutely on the floor. And it's all to do with recruitment and retention, the inability to recruit and retain nurses, other health workers, and a lot of that relates to our failure to provide affordable housing for nurses and indeed many other public sector workers. What are you going to do about it?
Richard Barrett.
The question that Deputy Boyd Barrett put to me in written format referred to general levels of recruitment within our public services, as opposed to the health sector in particular. But I'm going to respond back then to the question he's offered on the floor of the Dáil here in relation to the health sector. We have approximately 20,000 more people working in our health service than we did before the pandemic. So that figure is at odds with the narrative that you're putting here, Deputy, regarding our inability to deliver recruitment within our health services and keep people who are working there. We have more people working in our health services than we've had before, and we have had a level of successful recruitment that I believe is at a higher level than we've had in recent years. So there's more people at work in our health service than before, and one of the reasons why that is happening is a public sector wage agreement, which was agreed when our country was at a moment of great uncertainty. But the public sector wage agreement was reached due to the work of Minister McGrath because of our recognition of the contribution that our public servants had made to our country during the pandemic, and the need to give them clarity and certainty regarding where they stand, and also cognizant of the impact that the rising cost of living was having on them. In terms of what we are doing to deliver more homes, you do know what the answers to that are, but I know in advance of our exchange that you find them inadequate. What they are is building nearly 30,000 homes last year. What it is a record level of commencement of new homes within our country for the months of December and January. What it is building more social houses for use in our country than we have at any other point since the 1970s. What it is a rate of total housing completion that is up over 45% in the year before. But this government knows we need to do more. We need to keep on building those homes, and we'll take all the steps we can to deliver that.
Margaret.
Yeah, Minister, I think the problem is that there's no sense really from the government about the emergency that we're facing. I mean, the INMO do not take industrial action lightly. If you look at the statements about why they feel compelled to take industrial action, it's because there was 10,000 patients left waiting on trolleys during the month of February, and they make absolutely clear, for example, the President of the INMO, safe staffing should not be a pipe dream for nurses. Patients should be made aware of the severity of the staffing deficits our members are trying to work through. Hospital management in each location cannot keep trying to fill from an empty cup, and it goes on. And that's true, by the way, of teachers now increasingly, and a whole series of other workers where we're having difficulty recruit and retain. And central to it, it's not the only thing, but central to that is the fact, you know, when you talk about the new housing that's being built, in the area around St Vincent's Hospital, every new completed apartment block that is coming on stream, because it's private for-profit apartment blocks, €2,500 a month, €3,000 a month, €3,500 a month, €4,000 a month. Now, how is a nurse or a teacher or anybody else expected? They might as well not have built that stuff, because people can't afford it.
Margaret.
You might as well not have built it. Is that your attitude, Deputy? We might as well not have built it. Is that your response to the housing great crisis and difficulty that we're in? We might as well not have built it.
At that price, yeah.
Now, I accept that it's a rent level and a price that will be unaffordable for many. I accept that. But it will be affordable for some, and there will be some people either living in them or renting within them. And any increase in housing, Deputy, any increase in a new house, a new apartment being built, a new home being provided to somebody is progress. And it is also the reason why we have a level of social housing output, a level of new homes being built by our approved housing bodies, our local authorities, that is highest level since the 1970s. That's happening in tandem with that, Deputy. And we appreciate that more needs to be done. We appreciate that more homes need to be made available speedily. But I think your reaction back to that says you know, an awful lot about your attitude towards housing as well. And let me emphasise, in relation to those homes being built, we need more social, affordable housing as well. But that's happening too.
Yeah, okay. Well, I mean, this deserves a longer debate, but let's at least start the debate. You see, if a piece of land and the labour, in short supply, is busy building a private development that is going to cost €3,000 a month, that means that short supply labour is not building the public and affordable housing. That's what it means, in reality, when we don't have enough construction workers. So we are getting investor-led, profit-driven, unaffordable development, which the nurses, the teachers, all the workers we need cannot, even the workers who build the stuff can't afford this, right? And there's an opportunity cost there, because that means they're not building the public and affordable housing we actually need for the nurses, for the teachers and so on, so that they can afford to live in Dublin or in the big urban centres and therefore work in our health service. So I stand over that argument. And the Celtic Tiger proves it, by the way. We had record housing output, nobody could afford it, and the economy went over the cliff as a result of it.
I accept that we need to make progress in delivering even more homes. The government has had pains to recognise that. But in your worldview there, Deputy Barrett, there's no role for the private sector in delivering those homes. I mean, there are homes that are built in our country by the private sector, and they are built at a profit, and we need those homes to be built. We need a private sector that can build more homes, and in building those homes, they do make a profit. But in tandem to that, we need the private sector to be delivering homes at more affordable pricing. That is why the government has brought in a variety of different schemes, which I'm sure you have opposed, to enable the private sector to deliver homes at a lower price. But it's also why we have the biggest plans for the delivery of more homes through our local authorities and our approved housing bodies since any point in the 1970s.